awareness and immunization against respiratory syncytial virus (RSV) in India. Bengaluru, India, 8th July 2025. Medical experts in India are calling for urgent attention to respiratory syncytial virus (RSV), a highly contagious but under-discussed cause of lower respiratory tract infections in infants and children under 5. RSV, often mistaken for a mild seasonal cold, accounts for 3.6 million hospitalizations and 100,000 deaths in children under 5 each year globally. India, with the largest birth cohort of 25 million newborns annually, contributes significantly to this burden. The impact is particularly severe during the country's monsoon and early winter months, when neonatal ICUs experience a surge in admissions. Alarmingly, even healthy, full-term infants across all socio-economic backgrounds often require oxygen or ventilator support due to RSV-related complications. Therefore, raising awareness among parents and healthcare professionals about available preventive measures is critical to reducing the disease's toll on young lives. Dr. Vasant M. Khalatkar, current National President, Indian Academy of Pediatrics, IAP.
Move on to any further sort of discussions and questions, but quite happy to explain any point that might come up in my presentation and also what is not there. Quite happy to take that. So if we look at acute respiratory infections in infants and young children worldwide, there are multiple. There's a whole array of microorganisms, viruses. There's also bacteria like strep, pneumonia. But I mean, obviously we hear commonly about rhinovirus, we hear about influenza viruses, the flu virus, so to speak. RSV is not spoken about so frequently, but surprisingly, it is one of the commonest causes of and most frequent causes of acute respiratory infection in children, in young children and infants. So what is RSV? It's a virus, and how does it spread? We've just come out of a pandemic. So any respiratory infection which tends to cause first attack the upper respiratory tract spreads exactly in the same way. So I'll not go into the modes of spread. We've all lived through.
Care of the importance. You might have seen the scenario of 1 year before in Kolkata, and 6 months before that in Bombay, and same in Bangalore. So many cases of RSV infection we are getting, not that to be simple, but with the complication. Hospitals were full of respiratory syncytial virus infection. That was with the pneumonia, bronchiolitis, this acute exhalation of asthma. And what are the complications? We are always worried about complications because we are worried about the death. See, one thing is that this any viral infection, there is no treatment. So what is the treatment? We have to go for supporting. Suppose the patient is having the respiratory distress or pneumonia, severe pneumonia, we have to ventilate the patient. Once you ventilate the patient,
what can affect with severity to the newest born infants? Now, a vast majority of children might escape severe consequences.
And Dr. Vasant was very good explaining this. There is no treatment for an RSV infection. There is no antiviral, there is no antibiotic. We cannot do anything about it, just treatment measures to avoid complications. So we're facing two problems. Every kid will face RSV. We don't know who is going to develop a complication, and there is no treatment. So the only way we can protect our kids from RSV infection and the possibility of a complication or a hospitalization is through Beyfortus, which is a monoclonal antibody that will protect against the disease. How does it work? It works like every antibody we know. It's like a missile directed exactly to the virus. So it's a product that it's not for treatment, it's for prevention. In other words, you give the product to the child, and this is why it's important to give it on the first days of life, because then this product will protect. Once the child will enter in contact with the virus, this missile, the directed missile to the virus, will bind with the virus, will neutralize it, and will avoid the infection. And just to give you some example of what's happening around the world, there are countries in the world that have decided to implement this product as their strategy for prevention. In other words, they have taken the decision to immunize all their children before the RSV season. You need to understand that different from India, there are other countries that experience a clear seasonality during the winter months, which is they don't have circulation during the summer, nor between the months in autumn or in spring, but basically on winter. So in these countries where they know clear the seasonality, they vaccinate the children before entering the season and those who are born during the season. So they do a huge campaign, they immunize the children and they protect the newborns. And we have the recent experience of a country in South America, Chile, which decided to vaccinate all their population